Hello and welcome to this special edition of EC3 HOSA Medical Moments. Today we have Terry Bergen joining us again from the Lincoln Trail District Health Department. Terry is the Public Information Officer for LTDHD.
That's right.
You'll see that abbreviation a lot rather than spelling it out. But Terry, bring us up to date first on what your role is in this area and how you have prepared for this role.
Well, Gina, one of the things that I mentioned when we last spoke was that the LTDHD response to COVID-19, this is something that we do every day. It just happens to be COVID-19 right now. But we do communicable disease investigation every day. Even right now, when we're battling the COVID-19, we have our epi department that are still doing routine communicable disease investigations. So hepatitis C doesn't stop. Tick-borne diseases are starting to rev up. So there has to be somebody that continues to call those individuals, make sure they're doing the proper steps, and talk to them about preventing transmission and all those different things. And then on top of that, we have the COVID-19 that we're trying to investigate as well. So our primary role right now in this is getting the information out to the public, the correct information out to the public. 2, investigating those COVID-19 cases, make sure that people who need to self-quarantine or quarantining, make sure we contact all of those individuals. We also do a pretty detailed history in that when we call people who are confirmed cases, we ask them about their contacts and how long they've traveled in the last 14 days. All of those types of things go into these types of investigations. So I don't know if I mentioned this last time or not, but we also serve as a conduit for any personal protective equipment that is given to us by the state. And what I mean by that is that the state will drop off personal protective equipment, and I'm sure everyone has heard about that with the masks, the gloves, the gowns. And we are the ones that ensure that it gets out to the different healthcare facilities. They drop it here, we pass it out. That's what we do with that. So we have many roles in this current outbreak that we take care of.
I mentioned earlier, none of you are working from home right now.
No, but let me remind folks here, we have 6 counties, right? We have less than 100 people that work 6 counties. When you look at our 6 health centers, 15 nurses, that's it, out of those 6 health centers. And so basically a lot of times what that boils down to is 1 clerk and 1 nurse. What we've done is that the majority of our services are now over the phone. So we don't have a lot of traffic into those clinics because we're trying to protect the public as well as our staff. So, for example, if you want WIC services right now, if you, for whatever reason, this economic downturn has affected your ability to bring in the amount of money that you were bringing in, WIC may be an option for you. You just call, you do not have to come in, you enroll over the phone, and we will get you enrolled if you meet eligibility requirements. Now, we still have to do that, but most people qualify now, and they could get into the WIC program, which will provide them with additional food. It's a supplemental nutrition program for their families right now. You may also know, because the governor said that SNAP, KTAP, all of those benefits have been extended. People can apply for unemployment. So there are resources out there for them to tap into as well. So as much as we can do over the phone, we do. Now, as I mentioned before, we still have to do the communicable disease part of it. But most of the things that we do it over the phone. Not a lot of contact with the public right now.
Of course, this show is being taped on April 6th, 2020, to date.
Yes.
So by the time other individuals watch this, these numbers that Terry's going to discuss will probably have changed.
Yes.
So tell us a little bit about the individuals, the number of cases that we have in your district.
All right, so currently, and I had to write these down because I cannot remember them by heart, okay? But we do have 26 as of whatever time it is right now on Monday morning. 26 in all of our counties, as I mentioned, 6 counties. 10 of those are in Hardin, 2 LaRue, 5 Marion, 2 Meade, 4 Nelson, and 3 Washington. And the way it's been going, Gina, I can pretty much guarantee you that we will have more today because we've been increasing by numbers daily at this point.
Now, how many tests have been given in this area? And if someone wants a test, how does that work?
Well, this is the thing. The health department has absolutely nothing to do with testing. So if you, and I think most folks realize that you cannot come to the health department to get a test. The testing is between the client and the healthcare provider. So they determine who gets testing. Because our supplies right now, this much I do know. Because we have a pretty good relationship with our hospitals that are the 3 hospitals that are located in our 6 counties, is that they are limiting the tests for those who are sick, who are symptomatic, or who need some type of supportive care because the supplies are not where we want them to be right now. So we are still educating on the fact that if you don't have any symptoms but you're kind of worried, you're nervous, you don't know, you heard about someone that may have had it, just stay home and just call ahead if you're really concerned. So one of the things that people can do, because we want them to stay home if they're well but nervous, is they can call the public health hotline at the state. And that number is 1-800-722-5725. Now here locally, Hardin Memorial has a hotline that they can call if they have symptoms. That's the key factor here. And so that number for Hardin Memorial is 270-979-7777. And they're open from 8 to 4:30.
Now, does that work hand in hand with their drive-through respiratory care?
If I'm not mistaken, that is a different service that they offer, and I don't want to speak the wrong information here, but if you call that hotline, I'm sure they will tell you whether you need to come in for testing or not, through the drive-through testing or not.
Awesome. Now, we know the numbers. What are the ages and the genders of those that are in our district?
Now,
and again, we know those numbers will change.
Yes. Now, I'm really glad you asked me that question because there's a lot of information that we don't give out, right? And I know that can be so frustrating for people who want more information. But one, there's a couple of reasons we do that. One, we have to protect the privacy of all of our patients. We have done this even before COVID-19 hit. 2, one case in one of our rural counties, people will automatically know who it is. There is no way that we can provide that information and not reveal a person depending on what county it is. 2, 3, the other thing that we've discovered is that when people find out, because they generally do, people know people and they have conversations, and I believe that's who it is type of stuff. What we've discovered is a lot of times these people are really stigmatized. And so you will find people having threats made, on their lives, and why didn't they do this and why they didn't do that. We don't want to be instigators of any type of that additional hurt on families who are already going through a difficult time. What we want people to remember most of all is that when we look at this from the lens of public health, It really doesn't matter the age of the person, the gender of the person. What matters is that it's already in the community. You should be treating your neighbors like they have COVID-19. So you should already be practicing that 6 feet distance.
Which we are.
Yes.
Those at home, you can see we are 6 feet apart.
That's right. Don't be leaving your homes unless it's absolutely necessary. We already know that people have no symptoms or they're asymptomatic, so you don't know if you're coming in contact with someone or not. The age of the person, the gender of the person should not give you a false sense of security just because you know that person has COVID-19. Because of what we know, and I'm going to repeat this one more time, because we know that a lot of people do not have symptoms or have mild symptoms, everybody should be treated the same. It should not matter what the age or the gender of that person is.
That's awesome. Now, again, and of course, both the state and the national government have sent out little cards in the mail to
Yes.
say these are steps to take to protect yourself more.
Yes.
But like you said, also with the understanding that you should be acting as if you already have it.
That's exactly right, because you never know. You never know whether you have come in contact with someone or not. The other thing I want to stress a little bit too here is that the CDC over the weekend or just recently released the fact that people can now wear those face masks in public, the cloth face mask in public. I don't want people to have a sense of comfort, a sense of security by wearing those face masks and fail to practice social distancing. You need to keep in mind that the COVID, COVID-19 is passed, as we know, respiratory droplets can land in your mouth, nose, and your eyes. Those face masks doesn't cover your eyes, okay? Your eyes are still open and exposed. They kind of help to trap some of that in there, but those respiratory droplets can still penetrate that mask. So that's why it's even more important that you continue to practice that social distancing and stay home. Just because you have a face mask does not now give you the freedom to go out and mingle in public because you feel more secure. You can still contract COVID-19 with those cloth face masks. What I love about this recommendation, though, is that it frees up those needed surgical masks, those N95 respirators for our healthcare providers who really need them. And so that's one of the things I love about it. But I want people to keep in their minds, please, that it's not an ironclad guarantee that you will not get COVID-19.
Right. Now, you mentioned that our local hospitals were currently taking care of the individuals that have tested positive.
Well, not all.
Oh, okay.
Yeah, because some people don't need to be in the hospital.
Great. So explain that difference.
Well, some people will test positive, but their symptoms may not be that bad. So what the hospitals do for those who are ill and need to be in the hospital, they stabilize them and then they send them home. And so they may not complete the total course of isolation in the hospital. Once they're stabilized, the key is to get them home, freeing up that bed for someone someone else who may be more severely ill. Yes. So the more that we can treat at home safely, the more it allows our medical capacity to be there for those people who really need it.
So Terry, there are certain areas that have been contaminated, or we call hotspots, when individuals are kind of in a closed facility, such as a nursing home, cruise ships, things along that line. What types of steps do you all encourage those facilities to follow?
Well, we really want them to follow the CDC recommendations. Now, there's a lot of information on our website, ltdhd.org, for businesses as far as cleaning and disinfecting, and if you have a COVID-19 case in your facility, some steps that you need to take. But I think what's most concerning about like nursing home facilities is that those individuals are at higher risk because they're older, and a lot of them may have their immune systems are compromised. And so when it gets in those type of facilities, like the jails, that's another area. That's one of the reasons that the governor worked to get so many released, because you have those many people in one area, it's harder to practice social distancing, and so it sets itself up to spread more rapidly through a community, that facility, making it more difficult to contain. So it's very important that those businesses do preventative actions to prevent those things from happening as much as possible beforehand. And then once it does, then they need to ramp up even more with their cleaning, their disinfecting, the social distancing as much as they can with the families. If they're able to, the staff may have to don PPE, the personal protective equipment, all of those steps they need to do in order to keep their patients safe.
Now, the earlier you mentioned that you all also oversee some of the donations or the PPE products that are coming from the state. Is that, or do you keep track of that?
No, see, we are more, as I mentioned, a conduit.
Okay.
So they send us what we can have, and then we take that and then we spread it among our healthcare facilities throughout all of our 6 counties. So we have no control over what we get. And then what we do get, we try to disperse fairly among those in our counties. Mm-hmm.
Some of the businesses, I mean, from our last taping to this taping, a number of businesses have now been asked to stay closed.
Yes.
During this time. And also just recently, Walmart enacted a special policy too. How does that help? And I guess in terms of when you walk into stores, there's definitely a difference in terms of shopping now.
I am loving the businesses that I am seeing with the signs 6 feet here. You know what I'm saying? Like when you go into Kroger, for example, they have where you check out line, where you say 6 feet apart or distance. I forget what their sign says, but I love it. And then they have these little signs on the floor where you know exactly where you have to stand.
Also at Kroger's, they've even put up plexiglass.
Oh yes, Kroger's,
in front of their. I mean, that is
their
amazing.
Stations. I love that. Aldi's is another with the social distancing signs. South Central Bank, I've seen them on their that sign they have outside. Wash your hands for 20 seconds. Everybody is kind of getting on board with the social distancing piece here. Now, I'm gonna be honest. The businesses closing has helped, because it requires people to, one, hopefully stay at home. And then if they do come in, most of the businesses are great about keeping people apart. And so all of this plays into the fact that, one, you have less contact with people. The social distancing help with the lessening the transmission, reducing the transmission, and all of that reduces our cases. And I think because more and more people are getting on the bandwagon and doing what is right, that may be why our cases have not been as high as we expect. Now, having said that, we haven't reached our peak yet either. So we know that more cases are coming.
Right. I mean, that's always, it's going to be the case for at least a few more weeks, definitely.
Oh, yeah. Like the governor said, we probably won't peak until May. And so it is very important that people don't get tired of hearing that messaging and don't remain diligent in practicing the public health messages that are coming out. It's very important they continue to do that.
And it's also important for those of us that do a lot of telecommunicating.
Yes.
Our teachers in our district have been doing non-traditional instruction now this is our third full week of instruction, and we know we have 4 more weeks to go.
Yeah.
We are learning to do business differently, and
Yes.
That's helpful also. So one of the things that will probably come out of this is better sanitization.
It is. And I think one of the things that we've learned, just as in a personal example from the health department, is that we've learned, because we've had to change a little bit on because this has required us to change a little bit and adapt. We like some of the processes we have now in place better than we did before. So we'll probably keep some of the things that we're doing now. It is amazing what hardship will do, the ideas that can come out of that to make things even better going forward.
Mm-hmm. Well, I know that last week was, of course, spring break in the Hardin County School District, and we had wonderful weather.
Oh.
And it is important to get out.
Yes.
In the weather. So walking around your neighborhood and,
yes.
and things like that. But people still need to know that groups should not be together.
Yeah.
And let's talk about those personal things. I know that there was a recent incident at one of our local parks. And it's a shame that we have to close them down. But if people do not practice the proper space,
right,
it can become a hazard, because it could definitely affect many people within that gathering.
That's true.
And unfortunately, by the time people know about it, it's too late.
It is too late.
Yeah.
Yes, people are still, some people, not all, are not taking the social distancing message to heart as much as we would like. Even if you're outside, even if you're attending an event that's outside, which I don't know of any events that's going on now, because the governor has pretty much said avoid all large crowds and gatherings. You still have to maintain that 6 feet distance. Even if you are a business for whatever that's exempt from this, or an organization that is exempt from this, those rules still apply. You still have to practice that distancing, that physical distance of 6 feet or more, 6 to 10 feet from the next person to you. And the governor is very strong. And so if it is required, he will, I know, continue to close down places or things that will require to keep Kentuckians safe. And I think because of his aggressive actions so far, that's why Kentucky is doing so well.
I was going to say,
compared to other states.
Exactly. All of the states around us have much higher numbers than we do.
Yes. And it's because of that we know that it works. And case in point, like you said, all the other states instituted a lot of the things that the governor did later.
Right.
And so we know he was on board quicker, aggressive quickly. And it has probably saved a lot of lives.
Well, and it's definitely, it's beneficial to watch his daily updates.
Oh, yes.
And I mean, he really does lay out the information. He restates, which some people need restating over and over again.
Yes.
But for individuals that are still searching for information, talk about some of the things that you all do, your Wednesday meetings at WQXC, and again, where people can get information.
Well, thank you for plugging us for Wednesday, because Sarah Jo, our public health director, does a community update every Wednesday right now on QXC Facebook page. So it's not live anymore, so she tapes it and then it airs at 7. So that information is there, and she gives you the most relevant information at the time. We also do, right now, it's a daily press release, and so we send that out to all of our media partners, but it's also posted on our Facebook page, so Lincoln Trail District Health Department Facebook page, and our web page, and now again, that's ltdhd.org. You can get information there. The state has a website. It's called KYCOVID, so KYCOVID 19.ky.gov, that has a lot of good information. And then, of course, the Centers for Disease Control also has really good information. What's so great about that is every one of these agencies, usually they pull from the Centers for Disease Control, so their information is uniform and correct in that sense. So all three very good sources.
Let's just remind people at home, there are people out there that are scammers.
Yeah, that's true.
So what should people be advised from if someone calls them or reaches out via text or an email? Oh, look at this.
Yeah, I think they need to refer to one of the sites that I just mentioned. We actually have a flyer on our webpage that they can go to that lists all of the potential scams that may be out there right now, testing being one of them. For example, we had someone that was charging as much as $250 for a test. That is definitely a scam. You don't want to do that. Just go to our webpage. Look for that the scams from the Better Business Bureau that we have up there that you can find on our webpage.
Great. Now, by the time people see this, like you said, today more cases will come up. So always go to those websites for the most up-to-date information.
Right.
It's really helpful. So, Terry, again, we'll probably need to see each other again in a few weeks, maybe even next week, because it's going to be one of those things that we need to keep on top of, and we need to make sure that we know this is accurate information.
Right.
And that's what you want to do.
Yes.
And what's phone number again if people are concerned with the health department? If they have a question that they can call?
As far as the if they have COVID-19 questions?
Yes.
Yeah, they can call the Public Health Hotline at 1-800-722-5725. One of the numbers that I didn't mention was that if you see a business that is not complying, you can call the state hotline, right, at 1-833-KY-SAFER. That is the number for the state. But our environmental department as well has a hotline that operates from 8 to 4:30 every day. We really want you to call within those time frames to report. And that number is 270-982-7140.
Okay, great. Thank you, Terry, for coming in, and thank you all for joining us at home. And be safe, practice good sanitation, washing those hands as often as you can, 20 seconds or more.
20 seconds.
And use 99% alcohol wipes and things like that. Everybody just stay safe and have a wonderful week.
Okay, and I just want to say we recommend 60%.
Oh, 60%. Okay, that's good. 99% could maybe harm your hands.
Yes.
Okay, thank you again, Terry.
You're welcome.
And we leave on a little bit of a lighter note.
Yes.
So that's great. Thank you very much.